With half the population physically inactive, 2/3 of the population overweight or obese, rising levels of mental health problems, social isolation, chronic disease increasing, particularly by diabetes, the work of the McCaughey Centre is really important to create health, equity and wellbeing. So we're a multidisciplinary group and we're focused on the social, economic and environmental determinants of health. So our aim is to try and build knowledge that can be used by policymakers to create better communities, better settings in which people work, live and play. Our work builds on the work of our foundation patron, the late Dr. G. McCaughey. She was a tireless advocate, campaigner and researcher focused on health and wellbeing, health equity and human rights. In the last 10 years, the McCaughey unit has really provided some really important research on major social issues in society. That's included domestic violence, violence against women, climate change. We've had programs in race-based discrimination and child health and wellbeing. We're still continuing to work in workplace health. We have a program focused on Community Indicators Victoria, which provides data to the community so that they can do better planning to create health and wellbeing. We have a program called Social Infrastructure and Community Capacity, where we're working very closely with disadvantaged communities to try and help them to create health and wellbeing in their communities. Place Health and Livability is a program that has been undertaken in partnership with the Victorian Department of Health and Human Services. And our focus there is trying to do research that will assist in integrated planning.
It began very tentatively in 2011 with some of the things that we were concerned about, urban sprawl, transportation, the importance of people having the things they need in their lives not too far away, in fact close by. We're filming in a local village in inner Melbourne, which has so many of the amenities that people need and have the right to expect. Transport, local shops, public open space, education facilities, health and leisure facilities. These are the things that make a good village. And so the research partnership was very much about how could we make sure that people across Melbourne and in fact across Victoria had those opportunities. And that led to this notion of livability being part of our core research program.
The NHMRC Centre for Research Excellence in Healthy Livable Communities is really being set up to work very closely with policymakers, practitioners in the private sector, because we really want to influence policy and practice. So we have an advisory group that's made up of senior policymakers within government, planning, health, transport. We also have advocates like the Heart Foundation, Planning Institute of Australia, and we include work with the private sector because we realise that the private sector is going to deliver healthy, livable communities.
There's a healthy synergy and a symbiosis between the academic composition of the committee and the private sector and the government. So really a unique opportunity there, I think, to tailor a lot of the research outcomes to the specific needs of industry. And we have got a number of urban developers that are working in the metropolitan area that are looking for a more urban solution, I think a more compact, connected community.
So our partnership with McCaughey over the last decade has really seen huge gains in terms of making sure that we as an organisation are using the best, most up-to-date evidence base in our own work, so informing the work of this organisation, but also that two-way exchange, which means that we've been able to have ready access to world-class researchers to help us develop programs of work and kind of implementation research.
By having a partnership such as with VicHealth, it means that our research is really policy relevant and practice relevant, and they can help with the research translation component.
I think too there's some really practical outputs that go out to the sector more broadly, particularly local government through CIV, where you can see the direct impact of that information getting out to them in a way that's understandable and accessible, and you can see it as a product in their municipal public health and wellbeing plans. So it's really seeing how, quite hard research can be translated for policymakers in a way that makes it really easy for them to put into their work. And I think that's one of the real strengths of the centre and the people who work there.
Our unit's had a major focus of working with local communities, and one of the important ones has been the one through the city of Wyndham.
Working with McCaughey's been really great for us. It exposes us to a different way of working. a research-led arts project. Councils can collect a lot of statistics and demographics, and we understand who's living where, what they do, where they go to work, how they get to and from places. But this sort of research gives us a real kind of depth of understanding. So understanding people's lived experiences in places in a way that demographics just can't tell us.
In the last 10 years, a real hallmark of the work of the McCaughey unit has been to focus on trying to influence policy and practice, and in particular to work with the community, not on the community. It's involved really in-depth relationships and partnerships both with the community, policymakers and practitioners, and also knowledge brokers and advocates, and as a way of making sure that our research gets translated into policy and practice. We will continue with that important work of working with the community and working with policymakers and practitioners, how we create cities that create health, equity and community wellbeing is going to be a real focus for us in the next decade.